Medication administration tutorial. The patient's name is Kyle Miller. We're going to show how to give acetaminophen orally. Objective: after this tutorial, the learner will be able to access the medication administration record in the SIM chart, complete 3 checks and 5 rights of medication administration, and document medication administration. Locate the MAR for your patient. Our patient is Kyle Miller. Determine which medications are due by scrolling down on the med sheet using the scroll bar on the right-hand side of the screen. You are looking for green circles in the action column. Green light medications are medications that can potentially be given. Potentially because some medications may be PRN or as needed. For example, if the patient has Tylenol ordered for pain and the light is green, this means the patient can have Tylenol now. However, if your patient denies pain during your assessment, you would not prepare this medication because it's not necessary at this time. The last Tylenol was given at 0400 on Tuesday by a nurse with the initials AC. Finding the right information to do your checks. Remember to look at the time on your chart. Your SIM time does not always correspond to the time of day or day of the week of your scheduled SIM. For example, you may have simulation at 1 o'clock in the afternoon on Thursday, but the scenario day is Tuesday at 0700. You will need to complete all of your documentation in the EHR according to the scenario, day, and time. This is the rubric you are held accountable to throughout the program and the rest of forever. The same criteria for medication administration is used in lab, simulation, and clinical settings. This tutorial will walk you through medication administration. Start with the identification process. Which patient are you preparing medications for? You need to identify the patient name, medical record number, date of birth, and the presence of any allergies. Finding the right information. Name is located on the upper left-hand corner of the chart. Reading across from left to right, you'll locate the MRN, or the medical record number. For Kyle Miller, it's 823-7549. Date of birth is not included in the SIM chart, only the patient age. Patient age is not a patient identifier. Do not confuse age and date of birth. You should use date of birth as an identifier in the medication administration process. It will be listed on a sticky note in the bottom left-hand corner of the medication computer. Mr. Miller does not have any allergies. If he had allergies, they would be listed where the red circle is. After reading the patient identification information, you need to read the order for the medication. You'll start with reading again from left to right. All of the information for the check is contained on the patient's order. The drug is acetaminophen. The dose is 650 milligrams. The route is oral. It is due every 4 hours PRN. And you can tell by the green dot and the time that it was last given that it is due now. Next, you're going to pull the medication from the medication cart and compare it to the medication administration record, or the MAR. So you have read the entire drug order And you will say, in my hand I have acetaminophen, 325 milligram tablets, and you need 2 of them to equal 650. Expiration date is 8/2020. This would be the end of your first check. If a medication needs to be prepared before giving, do this before moving to the second check. Example, if you're drawing a medication from a vial, you need to prepare it in the syringe before moving to the second check. Insulin would be an example of this.
My first medication check, I have Kyle Miller, medical record number 823-7549. Date of birth is 12/27, and I have no known allergies. My first medication is acetaminophen tablets, 650 milligrams by mouth every 4 hours, due now. And in my hand, I have acetaminophen tablets, 325 milligrams times 2 tablets to make 650 milligrams with an expiration date of 08/2020. That completes my first med check. My second medication check for Kyle Miller, medical record number 823-7549 with no known allergies. I have an order for acetaminophen, 650 milligrams by mouth every 4 hours as needed, due now. And in my hand, I have acetaminophen, 325 milligram tablet, 2 tablets for 650 milligrams with an expiration date of 08/2020. That completes my second medication check. Hi, Mr. Miller. It's Kelly, your nurse. I'm back with your Tylenol for your fever. I just want to make sure that I'm in the right room. And then I'm going to just make sure that I've got the right medication one more time. Can you please verify for me, your first and last name,
Kyle Miller,
your date of birth,
12/27.
and I have Kyle Miller with a date of birth of 12/27, and I have a medical record number of 823-7549, and a medical record number of my chart of 823-7549. For my third check, I have Kyle Miller, medical record number 823-7549, date of birth of 12/27, and no known allergies. His medication order is for acetaminophen tablets, 650 milligrams by mouth every 4 hours as needed, due now. And in my hand, I have acetaminophen, 325 milligram tablet times 2 tablets to make 650 milligrams with an expiration date of 08/2020. That concludes my third check. Now I'm ready to administer your medications.
Documentation. If a medication has a green dot, this means it is safe and time to administer the medication. When you click on that dot, a pop-up box is shown. You will notice there is a red circle and the words "not verified." The red circle indicates the medication has not been verified. To verify, click in the patient ID box where it says click here and then scan patient ID. So click in the box, scan the band, and the number will appear in the box. Next, you need to verify the medication. You will click in the medication barcode box where it says click here, and then you will scan the medication barcode. Each medication in the sim lab has a barcode taped to it. Once this is done, if you have the correct medication and the correct patient, the red box will turn green and the word will say verified. It is now safe to administer it to the patient. After administering the drug, you need to sign out the drug as given. You will write the administration time in the box labeled administration time, and it must be the same time as the scenario is indicated on the chart that we showed in the beginning. Next, you'll indicate your initials in the initials box. Be sure to save your documentation. The process for signing out a drug after it's been given is the same whether you're doing electronic health record or paper documentation. You must sign out the medication date and time and your initials. In paper documentation, at the bottom of the page, you will write your full signature and your initials. When using electronic health records, your individual sign-in is already located in the chart and we can identify your
Action button. That means that it is safe and time to administer the medication. Then you click next to the patient ID, take your scanner and scan your patient's ID on their ID band. The next step is to click where next to medication barcode and scan the barcode for your medication. At this point, your screen will turn green, stating that the medication has been verified and it is safe to give. Your next step is to go down to your administer time and type in that time that you noted, which was 21, tab over 20. Type in your initials and hit save. Now that that has been done, if you scroll back down, you will see that there is no medication available to take anymore because it has already been administered.
safe medication administration, knowing the medication action for your drug, know the potential side effects, know why your patient is taking the drug, know any lab values or assessment parameters for monitoring prior to giving the drug and after, what to teach the patient about the drug, and the method or rate of administration. I hope this video was helpful. Thank you.